not realize, women don't realize that they're actually going through menopause or going through perimenopause. They don't realize what's happening, and therefore they don't even realize there's a conversation to be had. So number one is so important to understand that I'm going to use a quote from Benjamin Franklin, and I'm going to revise this quote a little bit so you understand the significance of it. There are two things that are certain: death and taxes. Well, we're going to revise that because for all women, there are three things that are certain: death, taxes, and menopause. If you are a woman, you will make the transition. The important part is, are you aware that the transition is going on? And in order for that to happen, there have to be conversations in the medical field. We need to do a better job of actually educating women as they're coming in for their well-woman exams. We should be preparing them for what to look for, but also conversations socially. The more we talk about it, the more we engage, then the more opportunity women have to be educated.
Yeah, absolutely. Like, it's the first step, right? It's just having this conversation and having it openly. But that shame that we talked about, I think it starts so early. It starts when we get our first periods. So, can you talk about how, like, all these different steps throughout, like, our female reproductive systems and all these, like, different steps and transitions that we go through in our health, how we're taught at every turn to not talk about this?
And that's so unfortunate. You know, we should live in a society where healthcare in general is spoken about every day and very openly and very honestly. And for women, we have to start having very sensitive conversations at a very young age. So when you are talking to your daughters or your nieces about having their cycles and being able to address their cycles monthly in a very so that they don't feel that type of shame, it starts there. Like letting young women know that this is normal. This is a part of you developing, and this is a part of you changing. And that change is something that should be embraced, and that we should look at it as a positive sign that you are making a transition into early womanhood, so that eventually, if you have the desire, then one day you can have children. It's all about the perspective, and I think it's time for us to change the narrative and have conversations that we are empowering our young women very early. Like, this is what to expect when you get a little bit older. You're going to start having a cycle. When you have your cycle, this is what you should expect. And if we start having these conversations of expectations,
just don't care at all.
and I would say we're actually live on Essence. Like, you just don't have you're kind of lacking that motivation. Yeah. You can't really seem to find your mojo.
Yes.
You're looking for like a passion, but you're not really sure what passion is. But if you don't find it, you might be okay with that also. You just are you're just not driven. You're not just not as motivated as you used to be.
Right.
So the last one is in the bed effect. How many people could like sleep for 12 hours? So the lack of energy, the fatigue. So those are the main signs that a transition could be happening. The hot flashes, the night sweats, the decreased energy, or what I also like to call the interest of that, like interest to walk out here and you could like not care.
I wouldn't care at all.
The decreased sex drive.
I mean, like, it just move. You blocking my arrow.
You know what's going on, and you know it's linked to possible hormonal changes. Then you are equipped to actually have a discussion with your physician, so that then we can talk about relief.
Ooh, I mean, there was one in there that you said that I had no idea was connected potentially to menopause or some of those changes that we go through, which was that I don't care effect. And so that is also something that I think a lot of the time, especially as Black women, when we're talking about the mental changes that are happening along with the physical, those are the ones that are downplayed, maybe not taken as seriously. So I want to ask you about advocating for ourselves, because I know all of us have probably been in a room with a doctor who does not pay attention to us, who does not take our pain seriously, take what's going on mentally seriously. So how do you in those moments advocate for yourself?
So I think this is such a great question, and the reason is because the majority of practitioners out there where the majority of physicians are working so hard to provide health care. We really are there for the patient. We really want to make sure that we are connecting with patients and that we are helping them with whatever medical condition that they are presenting to us with at that particular moment in time. But there are times where we could do better. We could do better as practitioners. We could listen more. The average data actually tells us that a physician will interrupt a patient within 11 seconds. Dr. Kelli Burroughs on Instagram, so feel free to follow me. I'll drop little nuggets of information, tips, values, but today I would like for you to just remember that recognition leads to relief. Open these conversations, talk to your daughters, inform them about what they are to expect, talk about it with your friends so they know that they're not going through it alone, and find a doctor that you trust. Thank you so much.